Hey, how is it being out of the isolation lodge? Right on. How are you enjoying the semi-isolation lodge? Yeah, it's amazing the difference one little window can make, right? Well, I know that it can seem a little lonely in there sometimes, even with the way that they allow other commune members to tap on the windows sometimes, but just keep reminding yourself that you are working toward a greater good. Don't forget, there is no I in isolation. Well, there is an I, but it's like more of. So, are you ready for your cranial nerve training? Right on. Have you ever had a cranial nerve exam before? Right on. Yeah, you look like the type. So, uh, basically, what I'm going to be doing is I'm going to be activating some latent neurons in your brain. I'm going to be going in through your ears and doing some stuff with your energy field, looking in your eyes to do that. And after that, we'll go through a bunch of exercises to stimulate your cranial nerves. And basically, as we stimulate those nerves, your newly activated neurons will send out these signals that will recondition your cranial nerves, and it'll make them much more susceptible to a whole bunch of things that would be imperceptible to the average person. That does mean, of course, that you might start sensing, seeing, hearing some stuff that you hadn't been able to sense before. But if that starts happening, don't worry. You're safe. You're in good hands here with me. But, I do like to warn people. Although I have learned that even if I warn people that something scary might be happening, they still like to yell at me a little bit afterwards. So let's just dive in, shall we? All right. Put this down. And alright, so let's start with some quick energy work. I'm going to go ahead and touch it, if that's alright with you. Yeah? Right on. So I'm just going to put my hands up here and kind of sense the energy field. It just keeps getting better and better every time I examine you. I love it. Okay. So I'm just going to start pulling out some of the negative energy, some of that spiritual debris that's kind of blocking my way here. Good. Yeah. Just sit there and relax. You're doing great. Gonna reach in here and pull it out. Gonna reach up here, pull it out. Up here, pull it out. Good. There's not too much in here. Gonna grab it and pull. Got it. Grab here and pull it out. Here, grab and pull. Right here, I'm gonna just pull that out. Alright. Looking good. I'm gonna take a quick look at your eyes. Can you put your eyes right on my nose right here? Not, actually physically, but just look at my nose. Good. Yeah. Right on. So I'm gonna shine this light in your eye. Just gonna kind of see what's going on there in your brain, energy-wise. So if you could go ahead and just relax while I shine it here. Good. I'm gonna shine it here. Perfect. I'm gonna shine it here. Good. just checking to see the way your energy field reacts when I do that. So I'm going to shine it right here. Good. Perfect. Looking good. And right here. Right on. Now, what I would like to do is activate those neurons by getting right up into your ears. I have a few tools I'm going to be using here. I'm going to look with my otoscope here. I'm going to stick this sucker right in each of your ears. Take a look around, make sure the pathways are clear. If need be, I'll clean them out a little bit, and then we'll activate those neurons, okay? Cool. Alright, let's go ahead and start on this side. I'm going to take this otoscope right here and I'm going to gently insert it into your ear right here. And I'm just gazing into your ear. Good. Perfect. Yeah, we're gonna need to clean this out just a little bit. I'm gonna put my fingers on the back of your ear. I'm gonna pull it up and back just to reposition your ear. I'm gonna get a tingle. Good. Yeah. Alright, I'm gonna stick around the back here. Take a look at the other ear. Alright, once again, I'm gonna gently place the otoscope in your ear right here. Good. And once again, I'm having a little trouble seeing, so I'm gonna grab the back of your ear and lift it up and back. There we go. Right on. It looks like this one's gonna need a little bit of cleaning too. That's no big deal. I'm gonna go ahead and take it out here. Let's see. Alright, so this cleaning part shouldn't be too difficult. I'm just gonna get into each ear with a Q-tip I got here, which I'm gonna spray with some fresh spring water, and I'm just gonna work it around real gently in each ear. It's gonna feel maybe a little moist and cold in each ear, but don't freak out. Or as my dad used to say, don't freak out and do that weird stuff, or we're gonna have to change the locks again. So yeah, just gotta stick it in, clean it out, and then we should be able to go ahead and activate those neurons. So once again, starting over on this side. Here we go. Looking good. Let's go ahead and move on over to the other side here. We're just gonna spray this Q-tip. There we go. And I'm gonna get right in here. I'm just gonna reach in right here. Perfect. Alright, well, now that your ears have been fully prepared, I'm gonna get right in there. And I'm gonna be making some sounds that are gonna activate some sleepy little frequencies in your brain. I'm gonna wake them right up, alright? But you just sit there and relax. You may or may not be able to feel it happening. Sometimes it's kind of like a tingly feeling that goes down the back of your head. Just relax, alright? So, starting over on this side, I'm just gonna alright. I can tell by looking at your aura when it's starting to work, so I'm just gonna get right in there and alright. Other side. Alright. Not done yet, so I'm just gonna move on to the next frequency we need with a little right on. They're really starting to charge up. Good. Alright. One more frequency and you should be good. You ready? Here we go. Yeah, that looks good. Alright, other side. Your neurons are lit up like a Christmas tree. Right on. Now, let's go ahead and write a few quick notes here. We're going to start by training your olfactory nerves with a little smell test. How's that sound? Right on. So olfactory, optic, oculomotor, trochlear, and abducens. Those are the first few we're going to do. So smell test and then pupillary light response. This little container here is a mixture of plants and herbs that are grown not too far from here. And you're not going to have to identify the smell, it'll be a little complicated, but I'm going to open up this jar right beneath your nose. And what I'd like you to do is just breathe it in, close your eyes, and just go ahead and let your mind free. Just imagine whatever it is that smell makes you think of. Alright? So let's go ahead and open this. I'm going to place it under your nose. Breathe in for me, nice big. And out. Yeah. There you go. Alright. Close your eyes for me. What does that smell make you envision? Alright. You can go ahead and open your eyes again. Close this. And open a second one here. One more time. Putting it right under your nose. Breathe in. Hold it. Close your eyes. Breathe out. And what does that make you think of? Alright, you can open your eyes. That's actually the first time I've heard that answer. It's pretty interesting. So, let's get in those eyes. You hearing or sensing anything odd yet? Alright, well, I'm going to shine a light in your eyes. Just checking to see how your pupils respond, so you don't have to do anything, just relax there, and I'm going to go ahead and alright, I'm going to bring it in real close. Just going to, and on this side. Right on. Next. I'd like you to look at my finger, please. I'm going to be moving it around, and I want you to keep your eyes on my finger as much as possible. You ready? Good. Perfect. So proud of you right now. You've come so far since you first got here. Good. again. Look at my finger. I'm gonna bring it in close, far away, close, far away. One more time, bringing it in close, out, in, and out. Good. This is already one of the better cranial nerve training sessions I've done here, so you can feel real good about yourself right now. I'd like to just examine your the size and shape of your pupils real quick. I'm going to bring the light back in here. If you just look at my nose, I'm going to shine it in there. And other side. Perfect. Alright, so next we're going to be training the trigeminal nerve. This one's going to be involving some touch. I'm going to be taking a sort of brush type thing and touching your face with it. And I'll also be taking a slightly sharp but not painful object and touching your face with it. Same thing with a cold object. I'm also going to be palpating some of the muscles on your face and asking you to follow a few instructions. But let's start with the light touch training, alright? So, here we go. In a moment, I'm going to ask you to close your eyes, alright? And I'm going to take this little brush here. I'm going to gently touch your face in a few different spots. I'll let you know when I'm touching you. I'm not trying to trick you or anything. And if you could just confirm that you feel it when you feel it. Alright, you ready? Go ahead and close your eyes. Close them. There you go. Alright, here we go. I'm gonna go ahead and touch. 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 A little bit on your ears here. Touch. 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 Other side. I'm just going to go ahead and touch. 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 Perfect. Now, the tip on this tool right here is a little bit sharp. It's not going to hurt you. Promise I'll be no more firm with it than I have to be. Once again, I'm going to tap your face a few different places repeatedly. And I just need you to confirm that you can feel it. So if you want to open your eyes, blink a few times, that's cool. Alright, now close your eyes. Just close your eyes. And I'm gonna go ahead and touch, 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 tap, 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 wish you could see your aura right now. It's amazing. Alright, so moving on. Alright, so the you alright there? Yeah. Stuff is starting to happen alright. Well, the stem of this tuning fork is quite cold. I'm going to be touching your face gently with it all over. All you have to do is close your eyes and confirm for me that you can feel it when I tap, tap, tap it on your face. Alright, so let's go ahead and close your eyes. There we go. Gonna reach on out and tap, tap, tap. 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 Other side, just gonna tap, tap, tap. 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 Alright, right on. You can go ahead and open your eyes now. Alright. I'm going to go ahead and touch your face a little bit. I'm going to place my hands on either side of your jaw. I'm going to gently palpate the muscles. Then when I'm done doing that, what I'm going to do is I'm going to ask you to clench your jaw shut very gently. I'm going to ask you to relax it. And then I'm going to be holding your jaw. I'm going to ask you to try and open it as I try to push it shut. Alright? It shouldn't be uncomfortable. It shouldn't be painful. It's just going to be a little bit of exercise. Alright? So I'm going to reach out here and gently palpate your jaw muscle. Starting up behind your ear. Working my way down. Right on the other side. Just gently palpating that jaw on both sides, working my fingers down your jawline, down to your chin. Good. Alright. Just clench your jaw, not too hard. Good. Alright. Now I'm going to be pressing my palms against your jaw. I want you to go ahead and open your jaw now. Open, 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 open. Good. And I'm going to press your jaw shut. I'm going to press. Good. Wow. You're special. But I think you already knew that. Alright, moving on. Let's go ahead and can you go ahead and lift your eyebrows up for me like this? Good. A couple more times, up and down, up and down. Yeah. Perfect. Wiggle your nose a little bit for me. Perfect. Smile. Great big, big, big smile. Awesome. Frown. Nice deep frown. Alright. I'm going to place my fingers on your eye. I'm going to try and hold your eyelid shut on this side, then on this side. And I just want you to try and open it against the pressure of my fingers. Okay, so I'm going to close your eye. I'm going to place my fingers right on there. Now try to open it. Open, open, open. Good. Other side. Close your eye. I'm going to place my fingers right on there. Now try to open your eye. Open, open, open. Perfect. I'm getting there. Alright, I'm going to be rubbing my fingers on each side of your head, here, here, and I'll be slowly moving them away. I want you to let me know when you can't hear that sound anymore, okay? So it should be nice and loud to start, nice and audible, and as I move it out, it'll get quiet. When it stops, let me know. Alright, you ready? So, say when. Alright, right now. Alright, other side. Say when. I'm going to take this tongue depressor right here. I'm going to gently place it on your tongue and have you say, ah. So if you could just let your jaw drop, open. Perfect. I'm going to reach in and stick out your tongue. I'm going to press it down. Say, ah. Alright. Now, I'm going to ask you to repeat some sounds after me. Okay? So as I say these syllables, I want you to say them. Alright? Right on. Ka. 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 Go. 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 Ka. Ka. Can you shrug your shoulders like this? Perfect. Alright, turn your head from side to side. Right on. I'm going to do a couple more resistance exercises. I'm going to go ahead and place my hands on your shoulders. I'm going to press your shoulders down. Right now, I'm going to press. Try and lift your shoulders up. Lift, lift. Good. Alright. Now I'm going to place my hands on either side of your face. I'm going to reach right in here and just try and turn your head this way. And once again, try and turn your head this way as I press my hands. Good. Almost done. I don't want to startle you, but you should be getting pretty sleepy if you haven't already. What I'd really like is for you to go ahead and get some sleep immediately after this exam. There's a lot happening in your brain right now, and the best thing to do is to, just pass out, have some nice dreams, and let all that new stuff that's going on in there kind of marinate while you sleep. Stick your tongue out for me, as far as you can. Move it to the side. Move it to the other side. Now, this has been an absolutely fantastic training session. So proud of you. However, you might need to go through a couple of these. So whenever you're ready, let me know. I'll come right back. We'll do this whole thing over again exactly as we just did it. For now, I want you to get some rest, alright? So I'm going to go ahead and turn the lights off. I'm going to count you down. I want you to just drift away. Alright? Right on. So, if you don't mind, I'm going to go ahead and there we go. Now, take a nice deep breath for me. Hold it. Breathe out. Good. Again, breathe in. Hold it. Breathe out. Perfect. Now I'm going to count you down from 10 to 1 and just let yourself slip away, alright? Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1.